we heard from those that were on the forefront of integrative healthcare settings and how they utilize research to integrate into conventional medical environments. And then during our last webinar, we reviewed a competency and evidence-informed practice that will help prepare graduates for these type of interprofessional environments. In other words, what are the skill sets that are needed for these new types of settings? And then today we're going to hear from individual educators that have integrated parts of this competency into their curriculum, making it work. And in case you didn't catch our other webinars, they are freely available and can be found on our website at optimalintegration.org. So I wanted to take a moment and introduce our speakers today. I want to mention all three are from ACAC President's Level member institutions, so we're very excited to have each of you join us today. So first I want to introduce Ben Marks. He is Ben graduated from the Oregon College of Oriental Medicine with a master's in acupuncture and Oriental medicine and has maintained a clinical practice for the last 8 years. He specializes in the treatment of athletic injuries and pain. In addition to his clinical practice, Ben is the interim director of research at the Oregon College of Oriental Medicine, where he teaches, writes, and oversees research activities at the college. His work has been published in numerous peer-reviewed journals, including the Journal of Complementary and Alternative Medicine and Medical Acupuncture, and his current research involves assessing outcomes for acupuncture and Chinese medicine in the treatment of pain in OCOM's busy intern clinic. So welcome, Ben.
Thank you. Thanks for having me.
Great to have you here. Next we have Jeremy Miller, and Jeremy received his initial massage therapy training from the Baltimore School of Massage and his Bachelor of Science degree in biology from Shepherd College. He's taught classes in human anatomy and physiology, professional ethics, and massage technique classes at massage schools across the nation, and he currently teaches the legal aspects of therapeutic massage class at Northwestern Health Sciences University. Jeremy has actively volunteered for the massage therapy profession, including accreditation site reviewer with the Commission on Massage Therapy Accreditation, an ethics and standards committee member for the National Certification Board for Therapeutic Massage and Bodywork, and from 2007 to 2014 led the ongoing effort to bring state credentialing to Minnesota for massage therapists. So Jeremy also joined the Penny George Institute for Health and Healing in Minneapolis of 2005, where he works full-time as a member of the inpatient team at Abbott Northwestern Hospital. So welcome, Jeremy.
Thanks so much. Glad to be here.
And we also have Dr. Brennan Smith joining us. He is a core faculty member at Bastyr University and Bastyr Center for Natural Health, where he supervises students in the Diabetes and Cardiovascular Wellness Clinic. He holds a Bachelor of Science in Human Physiology from the University of Washington. He earned his doctorate of naturopathic medicine from Bastyr University, where he also served as the first chief resident of naturopathic medicine. And during his residency, he also collaborated in conducting clinical research and has completed preceptorships in cardiology at Group Health Cooperative and the University of Washington Diabetes Clinic. His passion and expertise for integrated holistic care has led him to opportunities such as speaking at the Georgetown University, to the International Congress for Educators in Complementary and Integrative Medicine, and presenting at the American Diabetes Association Expo in Seattle, among other presentations. So welcome, Brendan.
Thank you so much for having me. Thank you.
So an overview of today's agenda, just a brief overview. We're going to start with an overview of the EIP competency that was covered in more detail on our last webinar. And this is really just to serve as a jumping off point for today's information. It's going to basically set the stage for our speakers. And we'll spend most of our time hearing from our speakers and then finish with a discussion on some of the challenges and helpful hints that they might have. So I'm going to start with a brief review, and this was covered in more detail in our last webinar, but again, this is kind of a jumping off point. ACAC, which represents 5 licensed integrative healthcare professions and 14 organizations, developed a set of 6 core competencies for optimal practice in integrative environments in 2010. And this ran largely parallel to the development of 4 core competencies for interprofessional collaborative practice developed by the Interprofessional Education Collaborative, which really consists of 6 conventional medical organizations. The first 4 of these competencies now overlap and are the same. And so I know this is a lot of numbers, and I apologize up front, but the bottom line is that we have agreement from a full spectrum of healthcare organizations, over 20 in all, on the skill set that graduates will need in order to be fully participatory in collaborative team-based care. And I mention this because Brendan will be speaking to this during his presentation, where they have implemented some of these first 4 competencies. Again, these are all, the full set is in your handout section and freely downloadable from our website as well. So in the last webinar, we did cover how ACAG had added 2 additional competency fields, highlighting the importance of these for our integrative professions. And this includes evidence-informed practice, which is the focus of our webinar series. In total, there's 7 sub-competencies that comprise the main competency in EIP. And again, we can have more detail on this on our website. But for today, I wanted to rehash that we broke these down into basically what I like to look at as 4 called conventionally based sub-competencies, and these that would most likely be found in a conventional evidence-based medicine course. But then today, this is what we're going to get to the heart of it today, leaving 3 of the 7, which are a little bit more integrative-based sub-competencies. And these are the focus of today's presentation. Each of our speakers has added in portions of these into their curriculum, which are really specific to our integrative professions and interprofessional care. So I'm going to start today with EP3, and this is a little bit more detail. I know there's a lot of words on the screen. This is all a set of learning objectives that's in a bit of a draft form, but I'll talk more later about what we're going to do with this. But just to give you the overall gist that this is really a focus on whole systems research. And today both Brendan and Ben will discuss how they have added portions of this into their courses. So I'm going to turn this over to Brendan, who is Dr. Brennan Smith, who is an assistant professor at Bastyr University, to lead us off. I'll let you take it, Brendan.
All right, thank you. So I want to quickly introduce myself. So I've been working at Bastyr University sort of ever since 2009, first in a role as a resident and then our first chief resident. And I had the opportunity through the R25 grant to sort of develop more evidence-informed practice within our curriculum. So what I was able to do is to sort of bring in some of those competencies first from IPEC, and then also sort of our specific competencies and our goals with R25 to really talk about whole systems research within the context of our critical evaluation of literature course. From that point, we kind of jumped in. If we can go to the next slide. Deb?
Did it go for you?
Oh, not yet. Sorry, everyone. There we go. So we wanted to look at this and really look at it from the basis of finding a way to engage our learners in the process of whole systems research. And to do that, we try to take this sort of pragmatic initiative towards identifying the right question for research to answer for our students. And so the major focus there was looking at patient-important outcomes and also whole systems research, taking into account both the hard objective outcomes and measures, such as, in my case, hemoglobin A1C for diabetes, but also in the qualitative measures of the patient experience and, let's say, self-efficacy and activation. So we've taken that approach into our research courses. I think one of the most effective pieces of implementing this throughout the entire curriculum was not just my effort alone within this course, but really taking advantage of our sort of motivated library staff and getting them to sort of lead the way so that we integrated these concepts into every class. How and where we added the competencies, it's a natural fit within a course such as our critical evaluation of the literature to talk about whole systems research within the context of qualitative studies. But I think within our overall curriculum, it really took hold when we discussed naturopathic medicine as a whole system for different approaches within conditions in cardiology, again in diabetes, and we know there are limitations to the whole systems research in regards to whether or not we can sort of capture all the important information, or are we missing pieces of information. And that, I think, still is going to take some development. But overall, sort of taking these competencies and keeping them patient-centered was probably the most effective way for us to bring this into our curriculum and have it matter for students and help them see how to put that in the context of sort of the day-to-day with patients. If you go to the next slide.
Did I come up for you?
There we go. Yeah, there we are. Thank you.
All right, it's a little slow today.
No problem. So for the interprofessional education, we're trying to implement whole systems research into the classroom, but then we also found it really important to carry this over into the clinical training as well. So along with one of our sort of nutrition faculty at Bastyr University, we brought in the IPEC competencies into our clinical curriculum, where we sort of have a combination of nutrition and naturopathic medicine students working together in patient care at our diabetes and cardiovascular wellness clinic. And so this sort of IPEC competency base was a natural fit for trying to build even more interprofessional sort of education opportunities within our clinical education at Bastyr University. You can read over these and take a look at them. Yet I will say from the feedback that we've gotten from students on this, both in nutrition and from naturopathic medicine, is really that although they had a didactic understanding of what the other professions would do, they didn't necessarily appreciate what that looked like in practice. And so really trying to find ways to sort of bring students together and apply these competencies in a clinical setting, I think really sort of carried it over from the classroom all the way through to our clinical education and probably made this most successful. So I'll stop there, but any other questions, I'm happy to sort of come back to them once we get to that section. Thank you, Deb.
Great. Thanks so much, Brendan. I like this approach to taking this all the way from the classroom into the clinical setting, and really helps to bring that home and really reinforce what you're learning in the classroom. And so while we focused on the EIP competency here, I also found it interesting that Brendan had incorporated 4 of our other ACAT competencies into their curriculum, and I'm glad that you're able to share that with us today, giving us other examples that maybe where we can put these competencies into existing training. So thanks so much. And then anybody does have questions, please feel free to type those on your GoToWebinar platform. I know we're having some technical difficulties today, and you can always also email me and we'll get some questions back to you as well. So next I want to turn the floor over to Ben. He'll talk a little bit about how they've integrated whole systems into Oregon College of Oriental Medicine. So Ben?
Great, thank you. Right, so my name is Ben Marks, and I work as the interim director of research at the Oregon College of Oriental Medicine. And we've worked to integrate research competencies into, we have 3 dedicated research classes that students move through over their 3 or 4 year time in the master's curriculum at OCOM. In the first year, we begin by laying out kind of the basic fundamentals of research and kind of those things that we would expect any research literate medical professional to be competent in. So things like where and how to access research information, what databases to use, and then how to differentiate between different types of evidence. What's a case study, what's a randomized controlled trial, what's a systematic review, and then how to evaluate those for their quality and their reliability. But then we transition into what I call like key issues in traditional Chinese medicine research, or those unique aspects of conducting research in an alternative medicine that might be different from biomedicine. And one of those key issues that we really want to emphasize early on is whole systems research. We want to kind of dedicate some time kind of right off the bat, year 1, quarter 1, to discussing this topic, because it really helps us lay the groundwork for the other competencies. You can go to the next slide. Great. So when I'm teaching research to first-year acupuncture students, I have 2 kind of implicit goals in the back of my mind, and one is that I want them to be exposed to those research literate competencies that I hope they'll work on through the rest of their time at OCOM and into their professional life. But the second is that they come to see research as more than just randomized controlled trials. That they see that other methodologies that are valid in a research sense are out there, and that good research is about asking the right questions and applying the right methods to what you're studying, and that one size does not necessarily fit all. So in that sense, talking about whole systems research early on is just a fantastic educational tool to kind of demonstrate that this is a possibility in CAM. There's this tension often between modern research methods and the practice of traditional Chinese medicine, and students come to a first-year research class either consciously or unconsciously, often grappling with this tension. And much of it, in my experience, is driven by this impression that what research is we want to look at single treatments, single biomedical outcome measures for specific biomedical diseases. And a lot of students think if that's all that research is, then that may be destructive or at least incongruent with the integrity and the therapeutic benefit of a CAM modality. So it can be really satisfying for a CAM educator to start to talk about these whole systems methodologies, and really illuminating for students to see that there are methodologies out there that can honor kind of the totality of their medicine. And so what we do at OCOM to kind of get the ball rolling early on is just to walk students through what we consider to be a really well-designed whole systems trial, and kind of break down those methodological innovations that are built into it that make it innovative and make it whole systems. You can go to the next slide.
Did it come up?
All right. Yes, thank you. So this is one of the studies that we often walk students through. It's from the Journal of Alternative and Complementary Medicine from 2008, a pilot whole systems clinical trial of traditional Chinese medicine and naturopathic medicine for the treatment of temporal mandibular disorders, or TMD. This was actually a 3-arm trial with whole systems TCM, whole systems naturopathic medicine, and standard of care compared head-to-head for 14 weeks. And I mean, this is a great study because it says whole systems in the title. And Cheryl Reitenbaugh has done a lot of great work on kind of moving the ball forward as far as quality whole systems studies. But if you're an educator, working in another CAM modality that maybe doesn't have a study that so explicitly lays out in the title, I think the important thing is just to select a study that captures some aspect of whole systems research that you really want to highlight for your students and kind of lay that out for them. You can go to the next slide. Great. So a few of the things that we like to highlight about whole systems research early on for students to kind of get a handle on through this trial are a really in-depth planning phase, combining multiple modalities together, and doing really patient-centered, individualized treatment protocols kind of built into the study protocol. In terms of the in-depth planning phase, a lot of clinicians will look at a study and say, that's not how treatment is done in the real world. I can't trust the outcomes of this study. And so it's nice to look at a study and kind of walk students through one that has a really in-depth planning phase that goes to lengths, the researchers go to lengths to incorporate experts, best practices when possible, and try to match the protocol to real-world treatment when possible. And it's great for students to see that that's being done in the research world. And then in terms of combining multiple modalities together, especially in acupuncture, a lot of the studies you see are acupuncture only, and they've kind of fragmented that modality apart from the rest of the modalities in the medicine that are traditionally used. And this study does a great job of putting together acupuncture, Chinese herbs, Tuina medical massage into this package of care and implementing it the way that most practitioners would in the real world for TMD. So it's a really nice synergistic package of treatment. And then, inherent in whole systems thinking is that patients are multi-layered complex systems, of course, and that one-size-fits-all treatments are inadequate. And so you really want to emphasize for students that, in whole systems research, having treatment that's individualized, flexible is really important. And in terms of this study, they did a great job of linking traditional TCM patterns with acupuncture points and herbs that practitioners might see for a population of TMD patients. And so students can really go, oh, okay, that's my familiarity, kind of what I'm learning in school with how we treat, and I can see that reflected in the research. And then, of course, looking at any limitations, I think it's a great exercise as an educator to just have students think critically and analyze research and look for ways that the research falls short or could be better in terms of capturing whole systems, and students really enjoy that, to kind of think critically about what could be better. All right, you can go to the last slide. So take-home points as far as what we hope students kind of come away with from year one thinking about whole systems research is just to recognize that there are methodologies out there that can honor the integrity of a whole system CAM modality, and that if they're done well, that research can still meet the standards of rigorous modern research. All right, I think I'll stop there. Again, if there's any questions, you can shoot them to the moderators, and I can answer them at the end.
Great, thanks so much, Ben.
Sure.
Wonderful. Thanks for sharing the thoughts on how this this topic incorporates the values of integrative care, and what a great example of how to add this in. For those that are interested in the study that you just spoke of, I will include a link to this in our webinar follow-up email. It'll be coming in about a week from me, along with when the recording is ready. This is all being recorded, so those of you who are on the phone and unable to see, I do apologize for the technical difficulties today. I'll mention up front that I'm in the D.C. area, so I don't know if it's something to do with what happened with our storm out here, but that's what's happening today. So also, this is a great example, Ben, that article that you provided of some of the resources that will be found in our Pearl Educator's Guide that I'll discuss towards the end of today's talk. So hopefully that'll be helpful to folks.
Great.
So thanks a lot. And as we covered earlier, there's two other more what I call ACAC-specific or integrative-specific sub-competencies that focus on basically communicating the risk and benefits of your professional services. And I have Jeremy on that. Jeremy will talk a little bit about how they've incorporated some of the EIP learning objectives into the course that he teaches at Northwestern Health Sciences University. So Jeremy, I'll pass the control over to you, or I mean the floor over to you.
Great, thank you.
Welcome.
So at Northwestern, we have a very purposefully designed program, and tell the students right up front, from day one, that the program that they've chosen to come into is a program teaching massage therapists to be part of the greater allied health profession. So we're focused on trying to get students to see themselves as part of the healthcare delivery system, as a ally of Western medicine, certainly of other complementary modalities and treatments. The class that I get to teach at Northwestern is it's called the Legal Aspects of Therapeutic Massage. And we have, as you see here on the screen, for those of you who have the video portion today, a pretty big class topic list. We go through the federal laws, the HIPAA and confidentiality and ADA laws. We talk about Minnesota-specific state laws and local laws. Here in Minnesota, we don't yet have a massage therapy credential, a license. So in the absence of that, we have other laws that we have to work with, and the students need to know what they're getting themselves into when they get out of school. So we spend a good deal of time on teaching them what the laws are here, so that they can certainly practice, legally. And then we also spend some time in practice and professionalism content, talking about, and this is where I specifically get into with them issues around evidence-informed practice, and we talk about it specifically in the informed consent content, to get them to be thinking in terms of the evidence that's out there indicates that massage therapy could be helpful with X, Y, or Z, and so I need to present this to my client in what I offer them as a treatment proposal, and then they can make that informed consent decision as to what they can say yes or no to, as far as what the student or then the graduate would be practicing with them. So if we could go ahead and go to the next slide. So this is a slide that I go through with the students and talk about what I call treatment plan math, where we talk about the student coming up with a treatment plan proposal first, where they take the client and referring provider's goals for coming for the session. as well as the assessment results. We add those two together, and then we divide that basically by their scope of practice as a massage therapist. And of course, for many practitioners around the country, the scope of practice is something defined by their state credentialing law. In the absence of a state credentialing law, we have a national certification that we can look to for an official sort of scope. But then we use the relevant evidence that's out there as sort of I talk about it in class in terms of being a multiplier of their scope of practice. The evidence of indications to help bolster their confidence that what they're applying with the client is going to be effective, or in terms of contraindications, to make sure that even if something is within their scope of practice, if it may be contraindicated for that particular client that's in front of them, for whatever reason, that would be sort of a negative multiplier and take that away from the proposal and sort of subtract that out. So we use the evidence that's available to us to try to inform, again, the evidence-informed practice to inform our treatment plan proposal. So we take that proposal then and present that to our client, and then our treatment plan is that proposal minus anything that the client refuses. So of course, in integrative care, we always want to make sure that we're being client-focused and client-based, and make sure the client has that sense of autonomy and knows that they are able to certainly refuse something that they're not comfortable with, or something that they don't feel would be effective. So that's our treatment plan math, and the students seem to be able to latch on to an idea like that if we can put it into sort of a novel kind of equation. Sure, yeah. So the students seem to oftentimes be able to really latch on to a novel approach to looking at what would otherwise be sort of cognitive information, to look at it sort of in an equation way. And a lot of times students make comments that they like the idea of the evidence being sort of a multiplier of their scope of practice, not in terms of increasing or decreasing their scope, but in terms of giving them more confidence, either to the plus or to the minus, that what they are doing is backed up by good research, and they can offer that to their clients or to the referring providers that sent the client to their care. So a lot of times our students really like that sort of idea, that visual of that being a multiplier. So if we can go ahead and go to the next slide.
There we go.
So just some ideas for inspiring students to use evidence-informed practice in our education. The goal, of course, is to get graduates to focus their treatment plans through this lens of evidence-informed practice. So we can teach them the cognitive goal. We can teach them what the evidence shows. So the current evidence indicates that X, Y, or Z, for whatever our modality is, or our treatment proposal, is a nice sort of cognitive goal. Finding and evaluating the evidence is, again, another nice sort of cognitive and in many cases psychomotor goal. So we can teach them how to use PubMed and CINAHL and Natural Medicine Database and even Google Scholar. We can teach them how to use those platforms to be able to locate the evidence that's out there, and then be able to evaluate it for the better or for the worse, to know what evidence we want to be using to make our treatment plan proposal. So the trick, though, is because evidence is such a moving target, because one piece of evidence will say one thing and another piece of evidence will indicate something else. The key is to get our learners and our soon-to-be graduates to a place of wanting to do that work. So we can teach them what the evidence shows now, but 10 years from now, 15 years from now, when they've been out in practice for a while, if they don't have it ingrained in them to want to do that research and to want to go in search of that, oftentimes it may sort of fall by the wayside, and the evidence that we teach them in school may still be in their head, but we want them to be at a place where they want to go and seek out that new evidence and seek out that new information as science progresses and moves the ball down the field, so to speak. The key is getting them to want to do that. So for that, I find that it's effective it's effective to look at the affective domain, where we're trying to sort of embed aspirational values into our students. And that's something that we can do not just in terms of evidence-based practice, but in terms of the entire practice that we are training them and raising them up to be able to offer. And if we can do that, if we can embed that, those aspirational values, and not just have it be what's the minimum I have to know to get out of school and get into practice, or what's the minimum I need to do to practice legally, if they want to practice at that high level, and getting that embedded in them in those early sort of formative years of their career, if we can get them to that, wanting to use the evidence-informed practice, I think will just be a natural outcropping of that effective training that they've received. So if we go ahead and go to the next slide. Great, thank you. So this is a slide that I use, I put at the beginning of every class, and I'm not sure why it's not the rest of the, oh, here comes the rest of the text. So it's a sort of a diagram that again gives them sort of a nice visual. If we think of the full profession, there's a lot of professionals out there, hopefully not a lot of professionals, but there are professionals out there who are out there practicing, but aren't even practicing to the legal minimum. And then there are those who just practice at the legal minimum. There are those who use that and then step it up a bit more to professional standards. And then those who add on ethical practice. But then the highest level, as we talk about it, is those who practice with all those levels and add on an aspirational, goal-oriented sort of practice. And so that's where them wanting to go and seek out that evidence as it comes forward is really going to be evident in their behavior. And I tell them every class, you get to decide, you the student, the soon-to-be graduate, you get to decide what level you're going to practice in. You know, we can sort of monitor them while they're in school, but once they're out of school, they're out on their own and they're doing their thing, and they get to decide, you know, what kind of professional they're going to be. And then I share with them, you know, some people have this idea right off the bat, well, who's going to even know or who's going to notice if I'm, you know, practicing at that level? And I tell them every client and professional that they work with will have, you know, that sense of them as a professional of that caliber, of that level, if they are, you know, behaving and practicing in that way. So the goal of the legal aspects of therapeutic massage class is to get them to the legal minimum and know what that legal minimum is. But then we talk about standards and ethics and aspirational based practices, and let them decide, and hopefully they'll choose that highest level. So we start every class in my class with that, and hopefully it will sort of dig in. The sharing experience, I believe, is a great way, sharing experience from practice is a great way to inform the students that if they do try to step to that highest level, that they can be not just successful with their practice, but more efficacious in their treatments. And if an instructor isn't themselves a practicing therapist or practicing practitioner, they can certainly use stories from others. But in any case, if we share experiences where somebody is practicing at that high level and using, in this case, using evidence-informed practice to inform their treatment plans, it will, by what we call in teaching classes, what we call vicarious reinforcement. The students will get reinforced by our experience and will sort of vicariously pick up that desire to, you know, step to that highest level. So from the first class, we set our goals overtly high, and we tell them we're doing that. And we draw the connection between a high standard of practice and having success in their practice. And if we infuse that high bar and that high level of practice into every class, whether it's a class like mine with the legal aspects, or a research class, or an anatomy and physiology class even, especially with a class like a technique class, if we infuse that high level, that high expectation and high goal into every class, I think it's our best bet for embedding those effective values. So our setting of high goals encourages them to do the same, so we're modeling that. And one of the ways that I do this, and there's certainly lots of other ways too, but one of the ways that I've found to do it is I talk about every person has their own mountain that they see. What their profession is able to get to is the top of the mountain. And if they think of that apex of the mountain and think about what do I need to do to get to that point? What classes do I need to take? What types of practice do I need to engage in? What professionals do I need to connect with to be able to get to that apex? And then sort of reverse engineer their career based on that goal, that high goal. It's a way that some students have sort of latched on to. So I think is that my last slide?
Yes, that is.
Okay, so thanks. That's my
Thank
little
you.
piece there. Yeah.
Sorry about again, sorry everybody for the technical interruptions in between this. Don't know what's happening today, but nonetheless, thank you so much, Jeremy, for that great example of really how you can start to incorporate portions of this EIP competency into your existing coursework, such as the legal ethics or the legal aspects course, and that might be another great place to put that in. So I think what's really I find most interesting today is that we've heard from each of you, our three speakers, and you all come from very different professional backgrounds, yet you're all talking about the same skill set. So I find this very fascinating, and this is really a great example of how evidence-informed practice can really help facilitate communication in these interprofessional, team-based environments. But I wanted to take a moment today to take the opportunity for each of our speakers to really discuss or chime in if they have any other issues that they want to add in terms of some of the challenges that you've encountered along the way, maybe how you've overcome those, some helpful hints or advice, and any next steps or thoughts that you might have for those looking to implement more of this integrative EIP competency into your curriculum. So I thought I would start out with Ben.
Sure.
And if you have anything else that you wanted to add on or something that you wanted to share today, that would be great.
Yeah, in terms of challenges that we've had at OCOM with integrating evidence-informed practice into the classroom, I really see the challenges falling into two camps. One is how to teach evidence-informed practice in like a dedicated research class where it's a quarter-long class all about research. And then the other camp is how to integrate evidence-informed practice into the other core curriculum courses. So in the acupuncture, Chinese medicine world, it's Chinese herbs, point location, things like that. So in terms of, in a dedicated research class, one of the kind of the basic challenges that I see is that a lot of students come in without familiarity with using databases and platforms. They're not familiar with how to use PubMed. They're not familiar with how to use EBSCOhost to kind of navigate through them efficiently. And so one of the things that we've done the last couple of years is actually co-teach that first year research class with the librarian. And I co-teach that class with her. And it's a great kind of synergy between, if I talk about whole systems research and the importance of using it, in clinical care, she can follow that up with, and here's how to use PubMed to find whole systems research in an effective, kind of efficient way. And that becomes a barrier for clinicians, is just how to navigate through these platforms quickly when they're in clinical care to find information that they would use clinically. So that's a real nice solution that we've come to. Another challenge in a dedicated research class that we've kind of come up against is students are coming to, study Chinese medicine, and I think it's probably the same with other alternative medicine modalities, and they're really excited about becoming clinicians. And when they're sitting in a dedicated research class, there's a little like, how is this relevant to what I want to do with my life and my career? I don't want to be a researcher. I'm going to kind of check out. And so really, one of the hints that one of the solutions that we've worked with is just really trying to connect the dots between, no, you're probably not going to be a researcher. The majority may not want to be researchers, but it's really important to be able to speak in a literate way about research with other clinicians, whether they're biomedical, doctors or PTs or massage therapists. It's a translational tool, and it's a really important professional skill to have. So, kind of inspiring that sense of this is a professional skill, and you want to make sure that you have this, in your tool belt, as well as being able to find an acupuncture point or, do a massage technique or whatever. And then the last challenge in terms of integrating evidence-informed practice into like core curriculum classes, so maybe classes that aren't taught by, people with a lot of experience in research, is another challenge. How open are faculty members to incorporating elements of research into, say a bodywork class or, a point location class or an herbal medicine class or a nutrition class. And so it really takes a lot of, working closely with faculty members who are open to that to develop, appropriate research information that can be embedded into those classes that feels seamless and it feels relevant to students and kind of helps them engage with the research competencies in a natural way as they move through a curriculum. And one of the ways we're thinking about doing that at OCOM is developing online modules that we develop in conjunction with, say, the herbal medicine teacher that students can access, at some point through, the quarter when they're in herbs and be thinking about research, engaging with it, but not have it necessarily take away from class time. So those are a few challenges, hints, steps, things that we're working on here to kind of integrate EIP into what we do.
Great. Thanks so much, Ben. That's a lot of great great hints and ways that you've overcome some of those challenges. Thanks for sharing. Appreciate it. Sorry, my slide. It's one day of technical difficulties left and right. Jeremy, do you have any other challenges or little hints that you'd like to add today? I'll give you a chance.
Sure.
I'm in.
Sure. Yeah. Thank you. In terms of challenges, for massage therapists, one of the big challenges of using evidence-informed practices, there's just not a whole lot of evidence out there yet that's good quality evidence. We're building that, and through groups like the Massage Therapy Foundation and the American Massage Therapy Association, we're working on trying to get more evidence out there, but getting students to see the value of doing case studies and even participating in bigger trials is a important piece to not just to their development as a practitioner, but also to the profession as a whole. And so at our school we do have, so I sort of introduce them to the ideas of evidence-based or evidence-informed practice. But then we do have a whole class on evidence-informed practice and how massage therapy can fit into that. And so if there is room in a curriculum to try to build that in, I think it's fantastic. I really like what Ben said about teaching that it is a professional skill to help students sort of latch on to the why of why we're teaching them that and making them sit through the classes on that. And it's working in a hospital as a complementary alternative or integrative therapist. It's so vital to know what indications and contraindications are in the evidence base out there, to know what we should ask a doctor for a green light to know that there's a reason why the hospital has a policy of us not doing leg massage without getting a doctor's green light. To know that there's a reason if patients ask why we have acupuncturists on our team, and to know why the hospital has a policy on that needing to be a doctor prescribed referral for us, as opposed to a referral from a nurse or a PT, as the other modalities can be referred for us. And to be able to answer that question for them, why those policies are in place, is so vital as a professional skill. So I am seconding Ben's mention on that. So those are just my couple comments there.
Great. Thanks so much, Jeremy. And yes, especially you're in that integrative environment, and you can see the value of keeping current with the literature and being able to effectively communicate your research base. So thanks for sharing that with us today. It's a great point to bring up. And Brendan, did you have any other thoughts or challenges as we kind of come towards the end of our webinar here that you'd like to share with us today, and some hints?
Yeah, I would say I would echo some of the remarks made by both Ben and Jeremy here. I think one of the fundamental pieces to our implementation of EIP into our curriculum was really to figure out that question of whether or not we were trying to train researchers or whether or not we were trying to train clinicians to sort of integrate EIP into their sort of everyday practice. One of the ways that we sort of address that challenge of, hey, our students, just zoning out, are they seeing this as separate from the clinical work that they're going to do, is we flipped the whole idea of teaching a course such as critical evaluation, which is our course where we look at sort of validity of articles and talk about all of the sort of information that helps us translate that research, I say, from bench to the bedside. And what we did is actually flipped it into case scenarios, so that every single type of research article that we evaluate for validity, we start with a real question or a real patient scenario in which sort of myself or my colleagues have had to go through and search the evidence for an answer. And as that example is used about how high up the mountain do you want to go, we try to take that to look at sort of, this is a normal thought process for any physician, especially for naturopathic physicians, that you're going to have to be able to weigh sort of first the validity of that research that is out there to say, is this even worth bringing into practice? Are there safety concerns, or is there efficacy that we feel confident in? And then translating that across over into delivery. And once you get into the delivery of those messages, then how can you sort of lay that out for informed decision making with patients? And so we really try to carry sort of that message through, that this part of their curriculum is geared towards the clinicians, and we think that the researchers are sort of getting their education as well in some of the other courses, but we know that we're training primarily clinicians, and therefore we need to keep it patient-centered and make it a part of every class. Within our modules, we've also hit that point where I think it's important to make sure that your faculty do have those small skill sets for being able to bring concepts of EIP into each class. So for us, it might be we talk about a therapy and we talk about the relative risk reduction, and we mention the study, and then we apply it to what does that actually mean for the patient, and then how do you then incorporate that into your treatment plan? What does that mean for informed consent? And so we try to make sure that there's always little snippets that get thrown in, and part of that was really making sure that the students were getting it consistently, meaning that the faculty involvement is huge. We send a lot of our faculty up to McMaster's every year to try to get them trained, and that way we have a solid base so that similar concepts are presented across classes, and they reinforce those research-centric courses, such as the early courses on methods, all the way up to sort of the critical evaluation level course. So those would be some of the main sort of things that we've learned so far that I've learned. And I think it is interesting as well how much it echoes both what Ben and Jeremy have been talking about at their own institutions.
Great. Thanks, Brennan. And yes, I think it's again, as I mentioned before, that all three of you are coming from different professional programs, but you're all three talking very much similar and going through the similar process here. So thanks for sharing that, and especially the tip to try to get this merged throughout your entire all of your faculty and trying to reinforce that, especially as you move into the clinic. So so thanks again for everybody for sharing their insights. If we do have any questions, I know that we're running a little late because of technical difficulties. We'll go ahead and try to get to those if you want to type those in. But I did want to mention that one thing that we're doing here at ACAC to try to help educators as they look towards implementing this is we're putting out towards the end of this quarter here an educator's guide to resources for evidence-informed practice. And for each of those 7 sub-competencies that I showed you earlier, we'll provide an overview, some of those learning objectives. You actually seen the draft ones coming out today, and some of the resources like the article that Ben had mentioned, different articles, textbooks, things that you can use to reinforce the sub-competencies, suggested classroom activities, and a short example of what it would look like to really be competent in each of those areas. So hopefully that'll be of help, and I'm really open to any comments or suggestions that anybody on the line might have today to help improve that, and you can email me directly as well. Again, to help faculty through this process, because there's quite a bit of information out there at this point. So I wanted to go ahead and just give a brief summary of today. I think we've had an excellent discussion here. We started out hearing from Brendan about how they've added the whole systems research into the STEER and how we've placed those first 4 of the ACAC competencies into their clinical setting. We heard from Ben about how OCOM has incorporated the whole systems research and how this fits great with the traditional Chinese medicine culture. And then Jeremy outlined how some of these learning objectives can be woven into existing courses, such as the legal aspects course at Northwestern Health Sciences University. So I want to thank everybody who has bared with us through a mountain of technical difficulties today. And I don't know if Jennifer's on the line, if we have a couple questions. I know we're running a little bit late, but if we could stay for a couple extra minutes and maybe at least do 1 or 2 questions here, I think that would be great.
Sure. Can you hear me okay?
Yes, just fine. Thank you.
Great. The question that came in was, does your whole systems research include the spirit realm?
That's an interesting question. So I'll put that back out to Ben or Brendan.
Yeah. It can. I mean, it depends on. It's not something that I actively look to build into an example in a study, but yeah, I mean, one of the things we talk about is that whole systems type approach to doing a study should include a range of outcome measures. And so one of the limitations actually in the example study that I show is that all the outcome measures are pain related. And a lot of students point out, well, what we'd love to see is outcome measures that cover mind, body, and spirit, if possible. And so it's something that I mentioned that it just depends on the researcher building that into the study, and it's definitely possible. There are outcome measures that they could add in. The other way that it's done often is with an embedded qualitative study in like a randomized controlled trial. And something else I like to point out to students is that if you build that in, you can kind of capture an impact on the spiritual realm potentially from a study that might not come out in kind of a standardized outcome measure. So it's something that I just touch on, but there's never enough time to go over everything in a class.
Right. Great. Brendan, do you have any comments?
Right, I would echo the same. I think it really comes down to whether or not it's addressed as an outcome measure. The reality is that is that there within the practitioner-patient relationship? Is that piece of it out there in the world? And yes, yet are we sort of grabbing those outcomes? Not usually. And so I try to explain to my students that one of the pieces that we're really looking at is, can we find that the sort of global care that is provided by, in my case, a naturopathic physician for a given, let's say disease, is there some signal of a positive effect or efficacy and the system of naturopathic medicine being effective for this condition. Then that next question would be, did anyone go and grab those objective measures, or did they get some qualitative data to really explore what's happening, and especially in the realm of sort of spirit in medicine? You know, I think it can be done. It would just have to be set up in a study at the very beginning. There's just so many different factors when we look at whole systems to incorporate that you need massive data sets.
Great. Thanks so much for both those answers. I think that's wonderful. When, you know, we're looking at that whole system, and we see some of the challenges that are to the research itself and the outcome measures, as you both have mentioned. And really, I hope that everybody comes away with this from the webinar, that really there's no magic bullet, you know, to this. There's still challenges, but hopefully we've gotten some ideas today on how to maybe overcome some of those challenges, how to start small and put these in different pieces of your coursework. So I do want to thank all of our speakers, and I want to thank everybody so much for bearing with all of our technical difficulties today. And hopefully you'll hear more from us in the Project to Enhance Research Literacy in the future. So again, thanks to everybody, and I'm gonna go ahead and sign off right now, and have a great afternoon. Thanks.